Let's start with our first section. In this section, we will talk about the different foreign bodies in the nasal cavity and then how the rhinoliths are produced. Rhino is the term used for the nose and lith is for the stone. So when the stones are produced in the nasal cavity, how they develop and what are the signs and symptoms and how they can be managed. So in this, as I mentioned, we will talk about mainly the foreign bodies in the nasal cavity and rhinolith, which is the formation of stone in the nasal cavity, how these two conditions present, what are the signs and symptoms, what are the different types, and how we can manage and treat these. So all this we will talk about in this section, which is the first section of our lecture, disorders of the nasal cavity. So first the foreign bodies. As the name show, is foreign body. It's the body entering the nasal cavity from the outside. So foreign bodies, different foreign bodies can enter the nasal cavity. This is commonly seen in children, very common condition. Lot of children, when they play with some things like small blocks, maybe rubber, or when lot of kids, they have different like sunny plus Legos, and then even when they are eating something, they can put the seeds of oranges and things like that in their nasal cavity, and it can sometimes cause, if it's not handled properly, it can even push further and cause complications or problems. So different, very common in children, mostly in children, and the cause can be organic or inorganic substances that can enter the nasal cavity as a foreign body. Common objects which can be, we can say they are the foreign bodies in the nasal cavity, are the chalk, button, and pebbles. All these can be a foreign body that can enter into the nasal cavity in the children mostly, and the reason is when the children, they are handling these different objects, they put them in the nasal cavity, which can go further back and pushed back. So all these are the foreign bodies. Pledgets of cotton or swabs may be left inside. If they sometimes, some children I saw, they have a habit of rubbing the nose from inside if there is burning or itching with a piece of tissue paper or thing. So sometimes even pieces of those tissue papers can stay inside the nasal cavity and can be a foreign body or foreign object. So mostly in the children, can be an organic or inorganic, mostly things like chalks, seeds, grains, pebbles, all these can be a foreign body. The clinical features of the foreign bodies, usually if it's immediate attention or immediate presentation, usually if the children, they are sitting and they are playing with something and they suddenly have difficulty in breathing or they started crying, usually that's the first thing that comes to the mind of the parents or whoever is the caregiver, that something might enter the nostrils that is causing the obstruction. So if there is immediate history, it can be managed immediately and there is usually no problem afterwards. But the problem arises when it is misdiagnosed or when it is missed, and if it stays in the nasal cavity for a longer period of time. So if it's overlooked, then sometimes if it stays unilateral blood stain discharge, so blood stain discharge starts coming out of the nostril, and it's usually unilateral because the foreign body is present in the one side. So unilateral blood stain discharge is common if it's overlooked. It can lead to the formation of rhinolith or nasal stone because sometimes the other particles keep on accumulating around the foreign body and it becomes hard and it forms the stone. It may lead to nasal diphtheria, which is an infection in which there is mucus discharge with pus and there is whitish membrane formation also. So it can be lead to nasal diphtheria and nasal myiasis, which we will talk in detail in one of our section today. So when there is maggots present, that is nasal myiasis. So this can also happen. And then acute and chronic unilateral sinusitis. Sinusitis is the inflammation of one of the sinuses. So this can also occur if the condition is overlooked. So we have immediate notice of the foreign body present in the nasal cavity. Treatment, it is removed and usually the person or the child feel better afterwards. And then if it is overlooked, then different conditions can occur, especially depending on how long is the time before it is actually diagnosed and it is removed. So all these are the different pictures showing the bloody discharge as a result of the foreign body present, then obstruction, foreign body. All these are the diagrammatic presentations of foreign body in the nasal cavity. Treatment is usually, if it's paper or cotton swabs, it can be removed. If it's rounded foreign bodies is usually removed by a blunt probe or the hook. You pass it beyond the foreign body. So important is, if you handle the foreign body from front and you try to remove the foreign body from front, usually instead of removing it, it can be pushed further downwards. So the technique is usually go back the foreign body and then bring it forward. That can avoid the pushing of the foreign body further down. If babies and if the foreign body is present in the babies, or if it's uncooperative children, if they are moving too much and they are not allowing the handling, then we can use the general anesthesia with cuffed endotracheal tube to remove the foreign body. And also, if the foreign bodies are lodged far and they are not close enough, then they should be pushed into the nasopharynx and then they are removed from that area because they are already far enough to go from the outside or from the nostril. So all these are the different techniques to remove the foreign body. It can be removed if it's swab or paper, usually rounded foreign bodies, because we can push them further. They should be removed by going back and then pulled out. And then uncooperative children, anesthesia can be used, and then if it's far enough, we pushed it into the nasopharynx and then it is removed from there. So this is the removal of the foreign body and the light source. Here the positioning of the patient. Complications of the foreign bodies, usually nasal infections can occur if the foreign body is present in the cavity for a long time. Usually it can cause infection and then sinusitis can occur. Rhinolith formation can also occur as a result of foreign body. And then inhalation into the tracheobronchial tree, which can further cause difficulty in breathing. Complications can occur. So these are the complications of the foreign body. We have nasal infection and sinusitis, rhinolith formation, and inhalation into the tracheobronchial tree can also occur. Next term I want to talk about is the rhinolith, which is the stone in the nasal cavity. The causes of stone formation is usually it can form, as I mentioned, that if there is a foreign body present and if it is overlooked, usually it can lead to the formation of rhinolith or stone in the nasal cavity. So formation around nucleus of foreign body. So around the foreign body, if the chemicals keep on accumulating, different secretions, mucus, and this can cause hardening and the stone formation. So around the nucleus of the foreign body. Another cause can be a blood clot, which can lead to the stone formation. And then secretions by deposition of calcium or magnesium salts. So if calcium and magnesium salts are present, they can also lead to the stone formation, and the stones are mainly also calcium and magnesium deposits. So all these are the different factors that can lead to rhinolith formation. Rhinolith, over a period of time, what happens if stone is present? Then over a period of time it can lead to certain complications, which include it grow into large irregular mass. So if the stone is present in the beginning, maybe it's small, but with time, with the secretions, with the deposition of different chemicals, it can become bigger and become a large irregular mass. It can cause pressure necrosis in the septum. Necrosis is the death of the tissue, and when there is constant pressure by a stone, this can cause the necrosis and death of the septum, which is the partition between the two sides of the nasal cavity. So this pressure necrosis causes destruction of the or death of the septum. And also pressure necrosis of lateral wall of the nose. Here pressure necrosis of the lateral wall of the nose can also occur. So all these complications can occur if the stone or rhinolith is present for a long period of time. It can grow into an irregular mass. It can cause pressure necrosis of the septum and also cause pressure necrosis of the lateral wall of the nose. Clinical features of the rhinolith, they are more common in adults. Unilateral nasal obstruction. If it's on the one side of the nasal cavity, it will cause unilateral obstruction, especially when it grows to a bigger mass. It can cause complete nasal obstruction and breathing will be difficult. So nasal obstruction, nasal discharge can also occur as a result of the rhinolith. And then if there is ulceration of the tissue or the nasal wall, then it can cause epistaxis, pain, neuralgic symptoms. So all that can occur with the rhinolith. A brittle gray, brown or greenish black mass between septum and turbinates. So usually the stone is, as it mentioned, gray, brown or greenish black, and it is between the septum and the nasal turbinates. Treatment is first the general anesthesia is given, and then removal through anterior nares. If there is a stone present under the anesthesia, here it is removed from the anterior side of the nasal cavity. Removal, if the stones are big enough, as with the stone in any other part of the body, big stones are broken down into the smaller pieces and then they are removed. The smaller pieces are then removed one by one. So similarly, if the rhinolith is big enough, then it is removed by breaking into smaller pieces. And also sometimes another procedure can be used known as lateral rhinotomy. Otomy is the opening. So rhinotomy, opening of the wall of the nasal cavity, and then it is removed. So all these different steps can be used. The stone is removed under general anesthesia as a whole, or if it's big enough, it is removed by breaking into smaller pieces or by opening the lateral wall of the nasal cavity and removing the stone. So this was all about section 1. Thank you for watching sqadia.com.